Welcome to the Erie Wellness Podcast, your go-to source for all things health, wellness, and living your best life right here in Erie. I'm your host, Lauren Brunetti, and I'm so excited to have you here. Each episode will dive into conversations with local experts and wellness professionals who are making an impact in the world of health and well-being. Before we jump in, be sure to like, share, and comment on this episode. We love hearing from you and seeing our community grow. Now let's get started. Welcome back to the Erie Wellness Podcast. I'm your host, Lauren Brunetti, and today we're diving into a topic that so many women face, but often struggle to navigate: perimenopause. My guest is Amanda Crisel, a doctor of pharmacy and a certified women's wellness coach, and she is on a mission to change the conversation around this life transition. Drawing from both her professional experience and personal journey with primary ovarian insufficiency, or POI, Amanda helps women shift from simply enduring perimenopause to truly thriving. If you've ever felt like you're on a roller coaster of symptoms and emotions during middle life, this episode is for you. Welcome, Amanda.
Thank you so much, Lauren. I love being here.
Well, we are so excited to have you on the podcast today. As a doctor of pharmacy, what inspired you to shift your focus from traditional pharmaceutical care to a more holistic approach to women's health?
A lot of people who get into the wellness space, either they've decided they're going to do it from the get-go and they want to do something related to wellness, or they've been through some sort of life-changing experience and it's prompted them to want to help other people in the space. And that's what happened to me. So I had a sort of a life-changing health situation, which actually was perimenopause at the age of 38. But before that, I had a great career in the pharmaceutical industry, almost 2 decades. And I was just sailing along. And then at 38, I started to experience hot flashes and night sweats and weight gain and joint pain, and this like utter exhaustion. And I was working full time at the time. And, I thought that I might be going through perimenopause because my mom went through it at 39, but my doctor said I was way too young. And so I went to see countless number of specialists, one for each symptom. And a couple of years of that later, my doctor said, I think you are actually, you're menopausal. You might be postmenopausal. And she said, hormone therapy could help you with your symptoms, but I don't, this was 8 years ago. She said, I don't recommend hormone therapy. It was still controversial at the time. So I was left feeling sort of hopeless. And my sort of quality of life, my functioning got to a place where I found it hard to do daily activities. So my symptoms, one of my biggest symptoms was anxiety and depression, along, of course, with the night sweats. So I didn't sleep. But it became sort of almost impossible for me to function. And I had at the time 5 and 3-year-old boys. And so I realized that I wasn't going to get sort of the traditional help that I needed. So I started looking outside of what you might consider like normal medical channels. And it sort of introduced me to this whole host of holistic or mind, body, spirit, or whole person options, these natural options that I could use to help me feel better and actually get out of bed, function better, sleep better. And so it started me on this, the better I felt over time, the more I wanted to know more about what was happening, why it worked, how it worked. And then I thought, I got to a point where I was like, I feel like I was functioning at my best. And I thought, I have to share this with other people. There are so many women who are struggling right now, younger and younger. And I would love for them to know some of the things. It took me 7 years to figure out some of this stuff and cobble these pieces together. I'd love to be a one-stop shop for women who are struggling like I was. And it sort of propelled me to leave my job in the industry and dive very deeply into women's wellness and perimenopause.
How frustrating at the beginning, questioning, am I going through perimenopause?
Yeah.
Is this happening to me? And then someone telling you you've already been through it. And you're like, I didn't even help myself during that period and be able to, thrive, or at least, be able to get through it okay.
The other thing, sorry, this is just, I don't want to interrupt, but the other thing that I found in retrospect that's really important, and I want people to know is what I learned after. And when I reflect, what I learned after is that the earlier you go through menopause, the more important it is for you to tend to your symptoms. Because the earlier you go through menopause, the more at risk you are for some of these downstream medical diagnoses like cardiovascular disease, dementia. So in retrospect, I'm sort of like, shoot, I wish I had known this earlier because I could have been doing a lot of things proactively. So.
Perimenopause is often misunderstood or overlooked. What are some of the biggest misconceptions that you see now? You said you were going through night sweats, some other things, but what other things might not a woman consider, but it could be the signs of the start of perimenopause?
There are so many, but I'll talk about sort of the top three that I see. The first misconception is around the symptoms. So you mentioned a lot of women will come to me with hot flashes, and that will be their biggest symptom. But when you dig a little deeper, they're experiencing things like anxiety and weight gain and joint pain. So that's kind of the first misconception. The what I would love women to know is that this hormone imbalance that occurs during perimenopause. So menopause is when your period has stopped for 12 consecutive months. So it's kind of like a point in time. Perimenopause is the time all the way around that. So your ovaries are slowly, I call it retiring, and your hormones fluctuate. So because estrogen has an impact on almost every system in our body, like our cardiovascular, nervous system, immune system, all of our systems essentially, and it serves this protective role. So when it starts to decline, we're left with this complex group of symptoms that can almost impact every system of our body. And the other two things that are root causes that I think it's a bit of a misconception that it is hormone imbalances and the reduced estrogen that causes a lot of these symptoms, but that also results in this low wave of inflammation outside through our body. When our estrogen starts to decline, we get inflammation, and we also experience a lot of times nervous system dysregulation. So that's why we're feeling that anxiety, the joint pain. Inflammation can also impact our brain, so we'll start feeling some depression, maybe. So the symptoms and kind of I think depending on the source, you could find up to 100 symptoms being related to perimenopause. The second misconception is age. So a lot of women, and I certainly are under the impression that, menopause or perimenopause doesn't start until, 40s, 50s. And there was actually just a study published on the 25th of February, because it was just last week, that studied over 4,400 women, the University of Virginia. And it showed that actually women between the ages of 35 or 30 to 35 reported, 50% of those women reported symptoms that could be classified as moderate to severe perimenopause symptoms. So that's 50% of women ages 30 to 35 who are experiencing these symptoms. And then when you look at ages between 35 and 40, it's 64% of women are reporting these symptoms. So I think the bottom line is that I tell women, you're not too young. You're very likely not too young. And there is a term for going through menopause before 40, the primary ovarian insufficiency, but you can start having symptoms with functioning ovaries. They're just dialing down their activity, but you can start having those symptoms in your 30s. And then the third misconception would be around, it's kind of a two-part, around hormone replacement therapy. It's called a lot of different things now. I think hormone therapy, menopause hormone therapy. I'm old school, so I call it hormone replacement therapy. And the first is that it's the only thing that's effective for our symptoms. And it's true that hormone replacement therapy is super, super effective for managing things like hot flashes, night sweats, sleep. And it's totally appropriate for some women. but it's not a cure-all. So there's still so many things that we can be doing from a lifestyle perspective, whether we're on hormone replacement therapy or not, that will, improve how we're feeling, improve how we're functioning, and set us up to be healthy in the long term. The other thing related to hormone therapy that I see is, of course, the stigma still exists that it's dangerous.
Mm-hmm.
And of course, people are still thinking that because it's been 25 years of us getting that message. And so what I try to tell women, even though I can't diagnose and I can't treat, and I can't prescribe hormone therapy, I just want women to know that there are a number of studies that indicate that hormone replacement therapy, the benefits outweigh the risks for several women. So it's always worth talking to your doctor about. But I understand there's still stigma around it. So I think providing information so that they're armed with what they need when they go in to see their doctor is kind of one of my goals.
That is so good. So much good stuff. And I love the idea of perimenopause is like you're kind of nearing retirement, and retirement could last a long time for you.
Yes. I call it like quiet quitting. It's like my ovaries quiet quit, and then one day they're gone.
Although, too, when you were talking, I feel like so many families are waiting till later on in life to start to have kids.
Yeah.
So, there's lots of women that are having children into their 30s, but
Right.
could also still be going through perimenopause at the same time. What are your thoughts there?
Yeah, that's one of the questions I asked my doctor because I had my children it's like 33 and 35. I have to do the math. And 38, I started having these symptoms. And I said, well, if this is perimenopause, can I still have kids? They're two boys. What if I want a girl? Everybody's like, aren't you going to have a girl? She's like, yes, you can still get pregnant, literally all the way up until your period just stops. And of course that for me was at 39. And so it became very clear that I couldn't have kids after that. But there are, women can still have children during perimenopause, for sure.
What changes would you love to see in the way that the medical community and society support women during perimenopause?
So I feel like there's more out there right now about menopause and perimenopause, which is fantastic. We've got a lot of, I think, vocal advocates. So I think we're getting to a point where it's becoming a little less stigmatized. But I still think there's sort of three things that I'd like to see. The first is some more education. I think women, I discovered I needed to sort of, even though I was a pharmacist, I had no clue what perimenopause or menopause was. I knew it was something that happened. I don't even think I knew the word perimenopause. So I knew it was something that happened. I didn't have to worry about it, I thought, until I was 50. And so I think women, you don't have to wait until you're feeling symptoms. Women in their early 30s can start educating themselves. I think there also needs to be education at the societal level, certainly at the practitioner level. I think it's pretty spotty in terms of which practitioners you go to and whether or not they have a good understanding of menopause and what's happening. I know around here in the Boulder area, it's getting better and better in terms of the understanding and how we're striving to support women going through this transition. But to be fair, for a long time, we never talked about it. Women never talked about it. So, and all of a sudden we're sort of like up in arms about it, but we've never talked about it. So now practitioners are like catching up. But I think I've heard this somewhere, probably from Mary Claire Haver, that, physicians do not get a lot of education in medical school around menopause. So education is number one. Number two, I think, is research funding. There's some statistic like from the NIH in 2023, they looked at how much spending was for perimenopause in terms of research, and it was like 1% of their overall budget. So I think research funding, not only to find treatments that are effective for women, but also to better understand what happens during perimenopause and what the long-term health effects are.
Mm-hmm.
And then the third is making these treatments accessible and affordable to all women who need it. I think there are all sorts of inadvertent, in some cases, barriers to women accessing the treatment that they need. And I think this kind of goes back to research. Once we understand the burden of this, I guess I'll say burden of illness, but the burden of menopause on society and on the economy, I think we're just starting to do some of this research. Slowly, insurance companies, public and private, will find that covering a lot of these interventions early will help save money in the long run. It'll keep women from ending up in the hospital from cardiovascular disease, fixing fractures because of osteoporosis. So I think making these, whatever the intervention is, if it's hormone therapy or it's supporting women as they're, modifying their nutrition, movement, just making those accessible and affordable for women is going to be it would make a huge difference.
Yes. And I mean, I feel like women weren't studied really at all until, maybe the last 10 years, if most of the studies were done on men. So we're just getting going on what kind of studies are being done on women and looking at our different life stages.
I think it was 1993. I think I was reading that 1993. It wasn't until then that manufacturers were actually compelled to have women in their studies. I feel like that was just yesterday. So there's a lot of data to be generated, but there's also a lot of data to be mined that will help us get a better idea of what women are going through and what interventions we can consider for them.
Mm-hmm. How do you blend evidence-based pharmaceutical knowledge that you got when you were a pharmacist with holistic wellness strategies when working with your clients?
So I think, because of my pharmacy background, I'm very data oriented. So I try to make sure when I'm talking to clients that anything that I talk about is supported by data, which is kind of funny, actually, given what we just talked about. But there are some data out there to suggest various interventions actually help with perimenopause. Sometimes I'll look not specifically at the perimenopause diagnosis, but maybe instead the anxiety, what has been shown to help with anxiety, if I can't find something that works specifically for perimenopause. But so I'm data oriented. I think the second thing is that I make sure that clients have the information, sort of empower them to know what's going on. And I give them the information about the pharmaceutical interventions like hormone therapy. Many women are prescribed antidepressants or anti-anxiolytics or anti-anxiety meds. So I try to make sure they have the information so that, again, they're armed with that when they go in to see their doctors. But my whole program itself is built around the holistic pieces. So I guess in a way I marry the two just by providing the information on the pharmaceuticals and then really digging in on the holistic or lifestyle choices that women can make. Whether or not they're taking hormone replacement therapy, they're going to help their symptoms and improve their overall health. And I just make sure that, they know it's not an either or. So a lot of women will say, oh, if my practitioner would just talk about hormone therapy with me, everything would be fine. And it's true, it's super effective for a lot of symptoms. But it's not again, I think I said this before, it's not a cure-all. So, and it doesn't have to be either or. You can be on hormone replacement therapy and still you should look at these holistic mind, body, spirit, whole person approaches to sort of round out your wellness and well-being.
Right. It's a good tool to have.
Yes.
But we have to have those key lifestyle aspects in place too.
Yes.
What would you say are like the key lifestyle changes or habits that women should consider making to be most effective in managing entering perimenopause and supporting them during that transition?
So the two I start with So the one I start with is sleep. But the reason I say two is because the second one is stress management. And a lot of women, when I talk about sleep, rightly so, will say, how can I sleep when I'm waking up at multiple times a night with hot flash night sweats?
Mm-hmm.
And I'm feeling anxiety and my mind is spinning. Like, how am I supposed to work on my sleep? And so what I had to do was work on the second component, which was stress management, which ultimately helped with my sleep. So I found that, meditation just 10 minutes a day before I picked up my kids, box breathing when I would feel a hot flash coming on, and then practicing throughout the day. Those kinds of habits trained my brain to just chill a little. And we talked about this nervous system dysregulation. It activates the rest and digest component. So,
Mm-hmm.
so those are the two, and that actually helps with a lot of other symptoms. I mean, sleep will help with almost all, if not all, of our symptoms. But there are other things, and it's a it takes time to see what works for you. So there's perimenopause specific nutrition choices we can make. There's perimenopause specific movement that has been shown to improve our symptoms. Um, I talk a lot about community. There's research to show that, making sure that you're surrounded by a good community and
Mm-hmm.
you're sharing your experiences actually helps with your symptoms as well. So those are just a few. I do get into mindset and kind of gratitude and spirituality as well. And there are some data around those that can that they can impact our how we experience our symptoms.
Mm-hmm. Oh, all of that is so good. I love like talking about all aspects of our health. And there's, there are so many things that can contribute and so many things that you can try and add in. And it's about consistency, and it's not about doing those things perfectly,
Right.
but putting an effort into, getting 8 hours of sleep
Yeah.
or moving your body in a way that feels good and all of those types of things as well. Managing your stress, like you said, 10 minutes in the
Yeah.
school pickup line, doing a little bit of a meditation, which goes back to our episode 2 when we did talk about nervous system
Yes.
regulation. So you emphasize on shifting the narrative from enduring perimenopause to embracing it. What does that transformation look like in practice, especially, for women who have children and spouses and are working and trying to do all of the things?
So this is probably the component I love the most, because once we get this right, everything else has a better chance of working for us. And it's mindset,
Mm-hmm.
which sounds easy, but it it's not necessarily easy.
Mm-hmm. We just talked
But
about this earlier in our
yes,
conversation before
exactly.
the show.
Yeah, exactly. Once I changed my mindset from like, I'm hanging on by a thread, I just need to get through this and survive. I mean, there were symptoms that needed to be taken care of like quickly. But as I started to feel better, I had more agency to think about, okay, if I flip my mindset from I'm just enduring this and I just need to survive to more of one of curiosity and like, maybe I can use all this like hot flash energy to learn something and to grow from it and to have something positive come from it. And a lot of us are at a stage in life where, well, I'll speak for myself. I'm at a stage in life where I was kind of wondering, like, all the existential questions. What am I supposed to be doing? Why am I here? Am I really just going to work for a pharmaceutical company? Like, and I think we can start to look at those questions when we've changed our mindset to um, like a growth. Even you can fake it till you make it, is something I've
Mm-hmm.
heard a lot of neuroscientists say. Like, this is going to change me for the better. Um, I can get curious about my symptoms and it becomes a snowball then. So I wonder why this is happening. Then I looked into what was happening, and then you can find the tools to address the symptoms. And then you start to feel better, and then you start to feel more in control. And it just has this snowball effect. And um, it just makes a big difference. Your mindset being more, I hate the word positive because I think there's a lot hanging with that, but like just maybe curious, maybe just more curious rather than, oh, like what fresh rubbish am I going to have to put up with today when I get out of bed, and more like, oh, okay. Humor also, I would say humor
Mm-hmm.
helps.
Well, our bodies respond to like the energy,
Yeah.
and if we're
Yes.
resistant to doing it, our body isn't going to want to start to change, even though we're adding in these new routines. If our mind is telling it like, this isn't going to work, we're going to do it anyway, but if we go in with a little bit more of a better mindset, our bodies aren't going to be so resistant towards the change as we're starting to hopefully navigate it.
Yeah, that's 100% true. Yeah.
But women do, they feel frustrated or they feel unheard when seeking help for their symptoms. So how can we help them better advocate for themselves in these medical settings?
So I think it's kind of a theme, I think, but the first one is just understanding what's happening with your body. Um, Understanding what's, you don't have to, just at least at a high level, like what's happening with your hormones, why, what that means for your symptoms. I think documenting your symptoms is something I completely underappreciated until pretty recently, but understanding, kind of documenting what symptoms you're feeling, when you feel them throughout the day, how intense they are, if, be able to take that to your practitioner. Um, Prepare a list of specific questions, which I have on my website, specific questions that you can take into a practitioner about, what's happening, what are my options, when should I start, what are the risks versus benefits, specific tests you can request. I think it's perfectly reasonable to ask your practitioner whether or not really you're experiencing symptoms. Um, to have some baseline tests done. So we tend to get our CBC, complete blood panels. Um, but we can ask for like nutrient deficiency tests that would show if we're deficient in nutrients, thyroid testing. So there are some tests, and it doesn't necessarily have to be, oh, you're diagnosing something, because it you're not going to diagnose perimenopause based on those tests, but it informs you sort of, this is your baseline. And then you can get those tests done periodically in the future and see what has changed. And the other thing is, if you find that you're going to get some help from your physician, and you're not happy with the answers, or you're not feeling comfortable with the answers, or you leave, with more questions than answers, find a new provider. There are a couple of websites, and I have this on my website too. You can go to a website and search for a provider in your area. And then there are also, online providers, which I think it's really nice to have face-to-face option. I think it's just going to take time for us to have this plethora of providers who have all the information that they need to give us, to meet the demand. Because right now, I think there's a lot of demand and not a whole lot of supply. So I would just say, don't be afraid to find a new provider, and yeah, just ask questions.
Such good advice. So we mentioned the lifestyle changes that we can make, like sleep, working on our nervous system regulation, getting in active movement, like those main pillars that we always talk about with health. But when you're adding in other things to your toolkit, like hormone therapy, like what are some of the other examples besides hormone therapy that you would suggest?
Well, so for me, I'll tell you what worked for me. This combination of making nutrition, sort of these perimenopause specific nutrition choices, like increasing omega-3 fatty acids, increasing fiber, um, changing my movement from this sort of high impact cardio situation to more of a strength training component. But I eventually started hormone replacement therapy 3 years ago. Once I figured out that I should have probably been on it a little while ago. I have an antidepressant, and I take several supplements that sort of everything together has helped me really kind of optimize the way that I'm feeling. So there are other, there are many women actually I know now when they talk about their anxiety, they're put on an antidepressant, which seems to help them. And it doesn't need to be, I know we hear a lot of, oh gosh, women are complaining of depression. Well, we should just put them on hormone therapy and then that'll take care of everything. And it's not necessarily the case. So there are other, and then there are other sort of, I guess, vitamins or supplements that we talk about a lot as having benefits in menopause. Like some women I've talked to have received some benefit from primrose, evening primrose oil. Turmeric helps with our inflammation. I talked about omega-3, vitamin D, vitamin B. They're all actually, I have a supplement guide as well that kind of gives the, the supplement and the symptom, and then kind of the level of data that is available to support to tie the two together. So, so there are a lot of other options. There's Estravera, I think it is. There's a hot flash medicine that just was launched by actually a company I used to work for, Astellas. So there are other options out there. And I think it's just trying to find again, like you said, the toolbox. You've got all the information in there and you just need to find sort of what works for you. And it takes time. Unfortunately, it takes time and some different, trials and errors. But once you have the information, you're like empowered to figure out what symptom you want to tackle.
Can we also touch on really quick, because if, we kind of dismiss all of these symptoms and things going on in our life right now, there could be some long-term consequences. Like you brought up earlier, osteoporosis, cardiovascular disease. Can you go into some of those a little bit more in detail for us?
Sure. Yeah. Actually, we talked I think a lot about the felt symptoms. I call them felt symptoms. And then there are a lot of unfelt things that are going on in our bodies during this time as well. And again, estrogen has such a major role to play in a lot of our symptoms. So there are things that we need to look out for. Like a lot of women will come and say, my cholesterol is my bad LDL cholesterol is all of a sudden through the roof. So we could have an increased risk of heart disease. I don't want to like be an alarmist here, but this is the data. So heart disease, dementia, osteoporosis, your insulin sensitivity changes. So there's an increased risk of diabetes. The inflammation itself can cause, GI issues.
How can listeners connect with you and learn more about your business and your work? I know you've shared with me you do hot flash happy hours, you have a Perimenopause Plus program, and I know you also do one-on-ones.
Yes. So I work with women a couple of different ways. Though, as you've mentioned, the one-on-ones and in a group setting, that's usually within the Peace and Perimenopause program. So the program is designed to inform women around what's happening in their bodies. We talk a lot about, I get pretty specific about what's happening because I think it's super important that once we know what's happening, then we have this sort of, we're empowered to make the changes that work for us. So I talk a lot about what's going on. And then the most kind of important part of the program is identifying the tools and resources that can work for women. We talked about these lifestyle choices, the holistic lifestyle choices that we find out what can work for each client because everybody's different, and what combination of things that work for us one day, in a few years might not work. So we'll have to, all we need to do is fill our toolbox with all the tools. And then we have this sort of agency to pick and combine as we need it. And then the third thing that we do through the program is build this community for women. So we have these weekly group, I call them coaching session, but they're really connection calls where women can talk about what they're going through, connect with each other, talk about things that are working for them, things that aren't working for them. It's really just a time for women to connect with each other and ask any questions that they have. And then you mentioned the hot flash happy hours we have every month. We have in-person hot flash happy hours here in the Boulder County area. And then I also host online hot flash happy hours for women who are outside of the area and who would still like the opportunity to connect. And again, it's just an opportunity for these women to get together in a community kind of format, talk about what they're going through. We laugh a little, we have food and drinks. And I always say hot flashes are not a requirement for attending, but I think it's proven to be a nice way for women to connect with each other and feel a little less alone in the process.
Mm-hmm. And yeah, that connection piece is so huge. I mean, that's another component of health. It's another pillar that we all need.
Yes. And I think we underestimate how important it is. And I'm finding how important it is sort of the older I get. So, it is one of the lifestyle choices that we can make that, not just perimenopausal women. I mean, not to get existential, but really it can benefit us all, the community piece. So, yeah.
I did think of one other question really quick. So
Yeah.
you mentioned kind of tracking your symptoms. How long should a woman do that to have an idea of is something really going on? And then presenting those like that to her doctor.
I think, probably a few months. It doesn't really need to be longer than that. Especially if you're having the longer the better, but I don't think you need to wait, for example, you don't need to wait 12 months of tracking symptoms before you go in and take the information to your doctor. If you're starting to notice symptoms, even if they're emotional, or, I don't know, we talked a lot about brain fog or, memory lapses, which were also huge for
so
me.
good too.
Huge.
Mm-hmm. That's a whole nother topic, I feel like.
Oh my gosh, I could go on forever about that. It really, especially women who are in high demand careers. But so I think, a few months of just noting your symptoms is probably enough to give you an idea for particularly like triggers. And I think that's where it's kind of important to educate yourself about all of the symptoms that you could be experiencing, because you might not necessarily know. Like, I would have tracked hot flashes. I never knew that anxiety and feelings of depression would be a symptom that I should be tracking. I just thought I was depressed and anxious. So I think it's good to know what those symptoms could be. And then there are all kinds of symptom trackers out there that you can use that'll help you do that.
Mm-hmm. And I think too, ask yourself, are you really functioning at a level that you're satisfied with?
So, yes.
Because I feel like so many women are like, well, I think I'm okay, but could I be better? And especially if they're not experiencing those well-known symptoms like hot flashes and those kinds of
Right.
things. But women who are just like, I'm not great, but could I be better? Maybe, and really having that conversation too.
Listen to your body. You know when something's not quite off. And I think sometimes we live in this world where it's like, I just have to be busy all the time. And sometimes stress is a badge of honor in a way. But if you don't feel like you're functioning at your best, there are so many things that you can do to feel better and function at your best and improve your quality of life. Those are the big ones. The heart disease. Well, and then honestly, the mental health challenges as well. If they're not addressed, that can become pretty debilitating for women over time as well.
Mm-hmm. Yes, absolutely.
Oh,
Okay.
stroke. So stroke, but that I kind of put that in the cardiovascular category. But yeah, estrogen has an impact on our blood vessels, and so it helps sort of relax them and decreases our blood pressure. So not having it around can have a big impact on our blood pressure, cholesterol, overall. Yeah.
Mm-hmm. Yes. So much, there's just things that you just need to think about, like, oh, I'm just in this busy season of life, we're raising kids and all of those things, but just bring attention to like what you're doing to your body now, could have some later consequences with other parts of our life and how we want to make sure, being able to travel and enjoy retirement and all of those kinds of things. So,
and that's one of the reasons, honestly, I'm doing this is because I feel like I wish there were things I knew 10 years ago. And I can't go back and change things for myself, but I can take all the things that I've learned and, help people who are in the same situation I was 10 years ago. And hopefully they can start to feel better, rather than over 7 years, pretty quickly, like several months or, a year. So you're 100% correct. There's so much that we can and several things that we should be doing to optimize our overall health.
If there's one message you want every woman to take away from our conversation today about perimenopause, self-discovery, and thriving in this transition, what would it be?
So I think the first one is you're not alone. There's literally over 1 billion women around the world who are going through the same thing. So you could be feeling whatever symptoms you're feeling, you're not alone, and there is help to be had. I think the other thing that I would love women to know is you're not too young. So just be open to the idea that your ovaries may be, on their way out, even if it's slowly. Equip yourself with trustworthy information. I think if you're listening to this, it's likely that you've heard or maybe are following social media. There's a lot of information out there now about menopause and perimenopause and lifestyle changes and choices. I think it's important for us to just be sure that we're educating ourselves with trustworthy information. And I think the big one that I learned, pretty late is that perimenopause is inevitable, but it doesn't have to be miserable. There are a lot of things that we can do to help us feel better through the transition and ultimately come out on the other side happier, healthier, more fulfilled, with a better well-being. There are lots of things that we can do that can give us more control over how we're feeling, which in and of itself can help us feel better. So, and you're not alone. I know I said that, but it's, I think, very isolating now because it's been such a stigmatized topic. So women are kind of like just now peeking around the corner and being like, I feel horrible. What can this be? So just talk about it.
That is so good. What a conversation. Thank you, Amanda, for sharing all of that. Just your expertise from your work background, but also the reassurance with your professional or your personal experience that, you can overcome this and you can be in a better place where you're feeling more like yourself again, and can just, continue to being your best self through all the different stages of life that we occur as women. So thank you, Amanda. I loved your perspective on turning perimenopause into an opportunity for self-discovery and renewal. And if you want to learn more about her work or connect with Amanda, be sure to check out the show notes for links to her resources. And if you found this episode helpful, share it with a friend who needs to hear it. Thanks again for being on the podcast, Amanda.
Thanks, Lauren.
That's a wrap for today's episode. Thank you so much for listening to the Erie Wellness Podcast. I truly appreciate you being a part of this journey. If you loved today's conversation, don't forget to subscribe, leave a review, and share it with a friend. For more daily wellness inspiration and behind-the-scenes content, be sure to follow me on Instagram at the Erie Wellness Podcast. I can't wait to connect with you again soon.